Libby Devlin. She is the Southern Region Director of the National Nurses Organizing Committee / National Nurses United. NNU has more than 150,000 members. It's the largest union and professional association of registered nurses in U.S. history. And I know Libby, I've worked with Libby, she's fantastic. She's an impressive organizer and an encyclopedia of knowledge, and without further ado, let me just turn it over to her.
Benefits from the current healthcare system. Who do we think benefits from this system? Insurance companies. Big pharma.
Politicians.
Hospital corporations.
Politicians.
Wealthy people who can access healthcare. Private equity companies who are making money off of the for-profit healthcare system. Who suffers under the current healthcare system? Poor people. Sick people.
Middle class
people.
Children.
People who have to buy their insurance because they're required under ACA to buy insurance. So there are 800,000 people in Florida alone who would have qualified for Medicaid under a Medicaid expansion. 800,000. They're part of, well, there's two categories of where they could have gone. One is they might be part of the 2.5 million people in Florida who don't have health insurance. Or they might be part of the 2 million people in Florida who purchase their insurance on the open market, whether it's through an exchange or through some other way. There's 2 million people that buy their insurance on the open market. So that 800,000 are in one of those two categories. I don't know which one, I don't know who's where, right? But one thing I did learn a couple of weeks ago, which I found to be shocking, people are sort of pushed into this, under the ACA, they're pushed into purchasing health insurance. And so they do. And so if you're not wealthy, you buy the bronze plan, right? Because that's the cheapest one you can buy. And under the bronze plan, 47% of the people who purchase the bronze plan do not access health care at all. They don't use it because they can't afford the deductibles and the copays. This is this thing that the Reverend raised earlier this morning. People who have less than $400 in the bank, which is a pretty significant number of people in this country, they're the ones that are buying the bronze plan, right? And they're the ones that can't use the doctor. 47%. A shocking and horrifying figure. It is horrible. So, in my view, we'll get into this a little bit later, but I do want to put out there that the ACA, while it did provide insurance for a lot of people, 20 million additional people picked up insurance, 29 million did not, and some significant number, including those 800,000 in Florida who would have qualified for Medicaid, it was a massive transfer of wealth from those people called Alice. The Alice folks, they just took all that money and gave it to the for-profit insurance industry. Anybody have a guess how much profit the insurance industry made in the first 6 months of 2017? $10 billion. 6 months. And where did they get it? From a lot of those Alice folks. So it's a system that is inherently unfair to people that are not wealthy and people that do not have a way otherwise to get health insurance. So who else suffers?
The doctors.
The doctors and the nurses, the people who actually work in the system. The patients. So here's a couple of more figures. 45,000 people a year in this country die for lack of health insurance. 45,000. That's like the equivalent of 15 9/11s every year. And we don't do anything about it. We don't care. We don't acknowledge it. It doesn't exist in our world as a problem. I mean, for us it does. But for the powers that be, who would go to war over one 9/11, but will do nothing about 15 9/11s?
per year.
Per year. Medical debt is the #1 cause of bankruptcy in this country. Health outcomes in this country are among the worst in the world. Infant mortality rates are in the same ranks as third world countries. because people don't access, if you had no health insurance and no ability to access care, or your deductible was $10,000, who would get prenatal care?
Nobody.
Exactly. Lack of health care for chronic conditions like asthma or diabetes. The outcomes are much worse because people don't get that chronic care. This is one that I did not know about until I was at a meeting with Dr. Paul Song, who's an oncologist. People without health care or with very high deductibles do not get regular common cancer screenings. So by the time they show up at the doctor's office, they're at stage 4, right? And very preventable deaths happen because people do not get cancer screenings because they don't have health care. 39% of people in Florida have their insurance from an employer-based insurance, which is lower than the national average of 49%. We have a much higher percentage of uninsured in this state than the national average. We're at 14% as opposed to 9%. And we have because we didn't expand Medicaid, and we have a much higher percentage of people on Medicare. So our percentage of Medicaid is a little bit close to the average because a lot of states didn't expand. Medicare, we have a much higher percentage. Uninsured, we have a much higher percentage. And that's why it's 10% lower.
So I, for example, do have health insurance through my husband's employer, which does not mean that our deductibles are easy to meet. Our deductible is $6,000 a year. Basically, we're paying for all the health care unless we get into a surgery or something bigger.
And I was going to raise that very, very point. How many people here have their insurance from their employer? Okay. How many of you love your insurance company? Okay, the lucky exception. There are some people who love their insurance company. But like you, many people have very high co-pays, very high deductibles, co-insurance. Right? By the time you're done paying for all of that, the average cost for an individual who has insurance is $10,300 a year. That's the average. Right? So there's all these people that are paying, $200, $300, $400 a month to their employer for their copay on the premium itself. Then you have the copay when you walk in the door. Then you have the deductible, right? And so if you go to the doctor, you are paying. If you have, God forbid, a major illness, you're going to potentially end up in bankruptcy.